will call, are you ready, Justin? Okay. We will call this meeting to order at 6:33 p.m. We would like to welcome everyone, and at this time, we would like to do a moment of silence and stand for the pledge. The pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item number 1, adoption of the agenda.
I have a couple of questions just about item 2. I know, we are in a special meeting and agenda items can't be changed, and I guess I might be a little bit confused on what we're trying to approve here. When it asks for in-person, I don't see anything in there that asks for any discussion about a hybrid model or anything, so I'm assuming we cannot discuss a hybrid model. Is that correct?
Brian?
Gordy, the way that I looked at it is, we are looking at all of those options, and I think that a hybrid model is one now. If we were to parse the words, it meant discussion and consider approval of return to school options, virtual versus in-person. I think that if we have virtual on one side, in-person on the other, and we come to some middle ground in the middle, I think that we're still going to be covered under this policy. And I've reached out to some other attorneys who are struggling with the same type deal, and they're doing the same thing, because there's a group that wants virtual, there's a group that wants in-person, and they're trying to meet in the middle. So they've done similar language on this. This was Ashley let me know this last week, so I was able to try to reach out and see what some of our cohorts across the state are doing.
So we feel like that if we stay in person, then we're not talking about total school, we're talking about we can discuss other models?
Yes.
Okay, and also on the other side, of course, I did think it was interesting that we were virtual versus, so I guess that means it's a fight or competition here, I guess, I'm not sure. I am laughing underneath here in case you're all wondering. When we talk about virtual, I'm assuming what we're talking about there is when school is closed. Is that correct?
I think what some people refer to it as NTI was corrected by my wife, who says this is distance learning. So virtual is not.
But if we close schools, that means we have to NTI.
Well,
that's the application we filled out, correct?
That's correct. So, but NTI is non-traditional instruction, and there are lots of different.
Right. Well, that's what I'm saying is that I just want to make sure. We didn't get any backup documents on this item, and I just want to make sure that when we say virtual, we're also saying NTI. Because actually our NTI program is a hybrid virtual program. Students can do by computer, students can do by just assignments, students can come in and talk to teachers if that's available at that time. I just thought the wording, I just want to be clear on the wording that we knew what we were talking about when we...
And I guess, did you see Lieutenant Governor Coleman's press conference today with the governor?
I haven't seen anything today.
She actually discussed that today as one of the options that they were looking at, or one of the things that they were going to do for the education system to allow for non-traditional type instruction programming.
Well, no, we have NTI. We've already been approved for that. That's what I'm saying, is that I don't know why we put virtual on here, why we just didn't put NTI. And I just, I didn't know if that was going to make a difference, because you are in a special meeting, and just want to make sure that we're not violating any kinds of special meeting laws with that. Because if we say we're not having school, then NTI kicks in.
I think that you're fine.
Okay. I'm good, thank you.
Make a motion to adopt the agenda.
Motion by Mr. Talby. I'll second. All those in favor, say aye.
Aye.
Opposed? Motion carries 5-0. Okay, public comments. Looks like we have a few, so if we could, we'd like to kind of limit it around 3 minutes if that's possible tonight. So we will start with Miss Erin Newton.
You're welcome. You're welcome. You're welcome. Thank you. Good evening. All right, so the sheet that I have presented to all of you, as you can see, that is showing the new COVID cases in Kentucky, and that's the rolling 7-day average since the last board meeting in July. As you can see, the trend is obviously increasing. There's a couple divots, but as you can see, that's either on a weekend or a holiday when the labs are closed. Okay, so of the new cases that were reported on July 27th, 21 were children younger than the age of 5. Data for March 13th, the last day of in-person classes across Kentucky. July 4th, the last day before health officials believe the increase in cases began, are presented for just reference purposes so you all can see the trend. Since the last board meeting, at the last meeting 2 weeks ago, the board decided to wait until tonight before voting on a reopening plan in order to see what trends develop with regard to COVID-19 in the state. And as you can see, again, that is the list of all of the dates since the last meeting. After consulting with the Trump administration's COVID-19 task force chair, Dr. Birx, Governor Beshear ordered new restrictions on bars and restaurants, mandated limits on in-person gatherings to groups of 10, and mandated face masks in public. Additionally, Dr. Birx announced yesterday that our country has now moved into a new phase, which she called extraordinarily widespread, on account of the numbers have dramatically increased in both rural areas and in our part of the country regarding Kentucky and several of the states that border Kentucky. Governor Beshear also recommended that schools remain closed until mid-August, at least as of today. He said, "I'm making that recommendation because I care about my kids. I care about your kids. I care about their teachers and administrators, and I believe everybody deserves a safe environment. While our kids' first day isn't until September 8th, the point is still that there needs to be great caution regarding kids going in person." These developments indicate the health and safety situation is, at worst, deteriorating and at best not improving. It is worth remembering COVID-19 spread in Kentucky and across the nation decreased after Healthy at Home or similar programs were instituted last spring. Accordingly, spread of COVID-19 in Kentucky and in Clark County began to dramatically increase after restrictions were eased in June, particularly after daycares reopened and people began to travel and socialize more, beginning with the July 4th holiday. Research findings on COVID-19 transmission. The evidence showing this regarding COVID-19 isn't limited to new case reports anymore. A series of new studies provide much needed insight into the disease, particularly as it relates to in-person education. Research in the AMA Journal asked the question, was statewide school closure associated with decreased incidence and mortality for COVID-19? The answer was, in the U.S. population based time series analysis conducted between March 9th and May 7th, school closure was associated with a significant decline in both incidence of COVID-19. Adjusted relative change per week was 62%, And mortality, the adjusted relative change per week, was 58%. In a model derived from this analysis, it was estimated that closing schools when the cumulative incidence of COVID-19 was in the lowest quartile compared with the highest quartile was associated with 128.7 fewer cases per 100,000 population over 26 days and with 1.5 fewer deaths per 100,000 population over 16 days. These results to the U.S. population, the authors estimated that school closure may have been associated with 1.37 million fewer cases of COVID-19 over a 26-day period and 40,600 fewer deaths over a 16-day period during the spring of 2020. A Chicago study in the AMA Journal examined the concentration of the SARS-CoV-2 in the nasopharynx, or the upper region of the throat that connects to the nasal passages, of children and adults. According to the results, children 5 years and younger who develop mild to moderate COVID-19 symptoms have 10 to 100 times as much of the CoV-2 in the nasopharynx as other children and adults. Whenever these young children cough, sneeze, or shout, they expel virus-laden droplets from the nasopharynx into the air. The study also shows that children from ages 5 to 17, also with mild to moderate COVID-19 symptoms, have the same amount of virus in the nasopharynx as adults ages 18 and above. The authors concluded it is likely that young children, while not as prone to suffering from COVID-19 infection, still drive its spread, just as they do with several other respiratory diseases. When you add this to the battle that will most likely occur with keeping masks on with young children, the results can be extraordinarily bad. A Chinese study found only 21% of people between 10 and 19 years old who became infected show symptoms. After contact tracing about 5,700 COVID-19 patients, South Korean researchers found that kids under the age of 10 spread the virus at about half the rate of adults, but kids between 10 and 18 spread it at a similar rate. What do these studies tell us, particularly those decision makers involved with schools? It tells us the CDC's classification of 5-day in-person classes as being the highest risk model impact to research. It tells us our state, community, and school district are not currently operating in a safe environment for students, staff, and their families. Thank you.
Thank you. Brent Sizemore.
Jesus, John. I'm going to read to you from a section I prepared called Outbreaks Related to Large Gatherings, and these specific outbreaks relate to school-age children. They run the gamut from young children from 5 all the way up to teenagers in high school age. If you need more specific examples of how dangerous the virus can be in close quarters, then these certainly should actually be paid attention to. The CDC detailed an outbreak at a sleepaway camp in Georgia last month in which 260 children and staffers, more than 3/4 of the 344 tested, contracted the virus less than a week after spending time together in close quarters. The camp opened on the 17th and closed due to the outbreak in 10 days. The children had a median age of 12. Of those who were tested and came up positive, 231 were age 17 or younger. The remaining 29 were adults. Data about these symptoms were available for only 136 patients. About a quarter, or 36, reported no symptoms whatsoever. The camp had required all 597 campers and staff members to provide documentation that they had been tested negative for the virus before coming. Staff were required to wear masks. This incident suggests that children of all ages are susceptible to coronavirus infection and may also spread to others. According to the CDC report on the matter, these findings demonstrate that SARS-CoV-2 spread efficiently in a young-centric overnight setting, resulting in a high attack rate among people in all age groups, despite efforts by camp counselors to implement the most recommended strategies to prevent transmission. Asymptomatic infection was common and potentially contributed to undetected transmission, as has been previously reported. This investigation adds to the body of evidence demonstrating that children of all ages are susceptible to SARS-CoV infection. According to epidemiologist Karen Smith, the incidents suggest that more outbreaks could center on children the more they are in close proximity. As she quotes, "I think what it shows is that kids definitely can be infected with this, apparently can spread this. I think that when kids get back together in the normal social networks, we're going to see more of these. Georgia's Gwinnett County Public Schools teachers began in-person pre-training last Wednesday, yet within 24 hours, approximately 260 employees have been excluded from work due to a positive COVID-19 result or contact with the case. According to the Atlanta Journal-Constitution, teachers have anonymously reported that in-person training and meetings are taking place without areas being disinfected and masks aren't being worn at all times, while others claim that their schools still haven't received any hand sanitizer. Additionally, look within this community. The Clark County Health Department recently identified a cluster outbreak associated with attendance at an Ohio church camp and some secret services at a church in Winchester. These outbreaks give us a preview of the possible results of a return to 5-day per week in-person classes. Thank you.
Thank you. Jones. Will Jones. Is there a Will Jonas? Jill. We can't read. Let me check this real quick, because there's a bunch marked out, and I can't tell who's wanting to speak and who's marked out and who's, so, okay, so, what is it, Jill?
Yes.
Jonas. Okay, so you signed in back down here?
Yep.
Okay.
Somebody before me? or-
Yes, let me just mark that one out then completely. And then Emma, is there an Emma?
Yes.
Okay, so Emma would be next, because she is signed in up here, sorry.
So I think they actually covered some of the stats that I had seen earlier today before I came in about Georgia County, or in the county in Georgia. But other school districts faced with the rise in cases and an inability to ensure a safe and healthy environment in schools, many Kentucky school districts have opted to change their model for the time being. Franklin, Letcher, Morgan, and Owsley counties have followed Jefferson, Fayette, and Bourbon counties' decisions to start the year with all virtual learning. Franklin Superintendent Mark Kopp said the whole reason for going online is to keep students and staff safe. Kopp said all 19 members of a special committee formed to study this all agreed this was the way to go. The Montgomery County Board approved a hybrid plan with option of all online classes. Like Clark County's options B and C, the Montgomery County hybrid plan entails 2 days of in-person class and 3 days online instruction per week, with students split attending either Monday and Tuesday or Thursday and Friday classes in person. The Montgomery County Board cited safety concerns as the reason they chose this plan. Barberville Independent, Harlan Independent, Jackson City Independent, Jenkins Independent, Middlesboro Independent, Pikeville Independent, and Estill, Harlan, and Knox counties will all use an alternating day hybrid model with parental option for full online instruction like Montgomery County. So as more schools go back to school, we'll see this throughout the rest of August and going into September. We'll see an inevitable rise in cases, schools closing down, and we'll be pressured to close our doors. At that point, teachers will feel rushed and unprepared to move to virtual. So, yeah, thank you.
Thank you. Okay. Amanda.
Well, hi there. So I'm going to kind of share on some of the personal side of it. But one thing is I've been in Clark County for the past 15 years, and I've been at the high school the whole time. And I have learned as a teacher, you wear many hats. You know, you're the educator, you're the mentor, you are like the cruise director is how it feels sometimes. And maybe a ringleader of a 3-ring circus. But I feel like the hat that we're kind of being asked to wear if we were in a full in-person schedule would almost be a hat that was too heavy to carry. I feel like we would be taking on, I just have a personal fear of cleaning my class in between the changes and getting everything done. Just the extra responsibilities. I know I just have concerns or fears that kind of stress me about it. That I just kind of wonder how that would work with a 5-day plan with us being at full numbers. And that's just an honest concern that I have. On a personal level for me, my mom's a widow and she's high risk. She lives in Western Kentucky. So basically, I've kind of spent the past several months, I've watched a lot of shows and read a lot of books, but I've been trying to kind of stay home, stay healthy, because one of the things I do every few weeks is that you can't get everything, curbside. So I do like my toilet paper, paper towel runs to take that to my mom. If we are in a full session, it really worries me, like how can I help her? Because my brother is hours away in a different state with the military. So on a personal level, I feel just a lot of stress and concern. And I wanted you to know, kind of from a teacher standpoint, just the personal level of how I know not just myself is feeling, but some of my coworkers are feeling as well. And I know there's no easy solution to this. I'm a very visual person, if you haven't already noticed by my hat story. But I'm a child of an 80s, and one of my favorite toys, do y'all remember the toy? It was like the shape of a toy, half blue, half red, with all the different shapes that you would put in. Star match up a star, square match up a square. I kind of feel like if we were to go kind of full, for starting off and being in person, it would be like trying to take that star and kind of shoving it into the square hole. I don't know how it's going to work. And I know there's not an easy solution. But I know as we look at these stats and the numbers, they can be scary. But I also want kind of the personal side to kind of be taken into it. Because my kids, my students, they're my babies. And so I also worry from just the standpoint of, their health and us staying safe. So I just wanted to kind of share a little personal side of kind of where, some of your educators in the district are at. So thank you.
Thank you. All right, Brian Foudray, you are next.
So I kind of just wanted to follow up on what we talked about last time and go over where we're at, in the district plan, and then just say once again, like as an education association and talking to members, like the things that we feel strongly about, and I'll be really brief. So under the current plan, there's a couple of points that I think are worth noting. Right now, staff are not guaranteed the paid sick leave for all scenarios under COVID-19. That's under the federal or state law. I know that some questions are still out. I've asked my leadership, which I know they're talking to the governor, and I know that within the district that questions have been asked of KDE about this, but it's until that is covered, I think it's really dangerous to send a group of adults, many of whom may have conditions that would make them susceptible to severe illness as a result of COVID-19 without having some sort of policy in place so that they are not faced with a long-term illness where they have to take unpaid sick leave. Right? So that's just a scenario that's the first thing that comes to me as an education proponent and as someone who's standing up for teachers in our profession. Second problem I see is that social distancing is impossible in most classrooms with the number of students that we have, and I'm not a mathematician or anything, but if I go to my room and I measure out the social distancing circles, I don't think I can fit 24 kids in a class. I usually have anywhere from around 30 to 33. So if I were to shrink that down based on the 28 or so % of parents that say their students aren't going to be attending in-person classes, that still will not permit the 20 to 24 students to sit in that room under social distancing. So that's the second, other than washing your hands and wearing a mask, that's right up there as one of the most important things we can do to mitigate the spread. Third thing I would say is that there's no specific policy on testing that the district has in place. So if you're ill, if you're a student or if you're a staff member and you present with a fever, you're ill, the policy is, and I know this, as I said, this comes from the health department, which I understand that, but what I think would probably mitigate the risk even further is if we had a testing policy in place where if you are out and you did have a fever, that you do have to show proof that you had a test and it's negative before you can come back. Another thing is we have the scanner. The scanners that are going to be in there, all of the different schools, and they check temperature, but a lot of the people that have it, particularly kids, don't present with those symptoms, so that's not going to catch them. If they did get sick for some reason, however, we would have that extra level of security if they did have to get tested and prove that they were negative before they could come back. At this point, like, to my knowledge, there's no board policy yet on mandatory masks, but that's still up in the, up to the governor, correct? Like, there's been no policy that you guys have passed. And the school-specific reopening plans for the 5-day per week in-person classes, I haven't seen them posted yet, for all the schools. I've inquired, on my own to see those plans, and I've seen some of them, but I haven't seen them, published officially. So for those reasons, once again, those of us that are in the Clark County Education Association and the board would ask that you do not vote to open schools on a 5-day plan, even if the parents have that option to do NTI or virtual learning, whatever you want to refer to it as. At this point, considering the recent uptick in cases, like Aaron mentioned, and the rationale laid out at the last meeting, we believe a virtual start to the school year for the first couple weeks or a hybrid model like the one approved in Montgomery County are better options. However, if you guys do vote to follow the 5-day per week in-person model, we would ask that you take a couple of steps and approve these things or make these changes before teachers get into the classrooms and students get into the rooms. The district could notify staff in writing or email prior to the start of school to let them know that they have the option to work from home throughout the pandemic if they or a family member in their home is immune compromised, specifically with regard to COVID-19, with no repercussions. The district could create a policy on a threshold of infections at state, county, school district, individual school level that would necessitate shutting down an individual school or district for a minimum amount of time. The district could create a policy on mandatory masks and social distancing throughout the district, something that is maybe, even more, like I've said, it's more than just, well, we recommend social distancing. It would be more if you could guarantee social distancing in those classrooms. And district should create a policy guaranteeing no teacher should have to use their own sick days or take unpaid days of leave as a result of COVID-19. You could create a policy on students and faculty quarantine procedures that take into account testing, as I mentioned earlier. And you could create a policy on cleaning supplies and ensuring new staff are there for these new types of tasks that are going to be necessary under operating a 5-day in-person classes throughout all of our buildings. Teachers and staff, I'm not sure that the custodial staff will be able to manage all of the things that they're asked to do in that scenario. But anyway, these are the recommendations that we've come up with and the requests that we've asked if you guys, make your decision tonight. Thanks.
Thanks. Kate Greenwell.
Hi, good evening. So I'm here to speak not only on my behalf, but also for my coworkers, they're my friends, and our students. Let's first acknowledge that being in person for the school year will not be anything close to normal. I know that's what kids want, but that's not what they're facing when they come back into our classrooms. Several students have sat in on a planning meeting and realized that the things they were looking forward to at school will be stripped away for the sake of approaching safety. And I say approaching safety because realistically, school will not be entirely safe from COVID. We can't keep it out of everywhere. We will not be able to socially distance in our classes. Students will have to then wear a mask all day, and teachers will not be able to circulate and safely work one-on-one with kids. This also helps build positive relationships, and then they lose the human interaction element of school. This means that on top of staff members' concerns about COVID itself, the stress they feel can impact that class dynamic. Staff are being asked to do our job, but what that translates to is risk your life for the facade of normalcy. Risk your life or your loved ones and don't see them for 9 months to do your job. We are being asked to choose financial practicality or the lives of people we care about, and our students are included in those people that we care about. I have the added responsibility and concern of being pregnant and being due in September. My doctor has already said that I can work in building in my room during August to prepare for my sub, but she wants me to quarantine rather than see students once school is scheduled to start. This means that my sub, a retired teacher who has graciously not backed out on me, will be starting the year and taking on this risk for me to be able to protect my 4-year-old and my soon-to-be-born child. This means that I'm even more concerned for what I will return to after maternity leave when I have a newborn relying on me for their safety. We have seen how dramatically the situation with COVID can change in 8 weeks. Then add to it the start of cold and flu season, and I will be one frazzled, tired mom with a newborn. My story is not unique even within my school, let alone this district. Many staff members worry for their own children that are school-aged, or they have newborns that they have to put in daycare and then care for after 160+ contacts in a given day. Or even other family members that are vulnerable to this virus that they care for after working with all of those students all day. I implore you to make the best long-run decision for our staff, our students, and our community. Make it tonight so that teachers can do what they do best and prepare for the ever-evolving world of education. Right now, staff are having to prepare twice as much for the what-ifs, and it adds stress and tension to the concept of school. Make the decision to go full virtual to start the school year so that staff can take the next month to work and improve on what we learned from last spring. Last spring, I had less than 24 hours to prepare for NTI, and I adapted, and I learned so much through that process about myself and my students. Imagine what we could do with a month to prepare. Going virtual to start the year makes us part of the solution instead of contributing to the problem of failing social distancing in our state, as some of those stats told you earlier. On average, I would directly interact with 180 students a day. They come from many different classrooms before mine. They go to many others when they leave. Some even just stop by to say hi or ask for some math help. This means that they then go home to our families, or to their families, and our entire community's contacts will go through the roof. Knowing to expect virtual learning provides a new normal and more stability than starting in person and waiting for the other shoe to drop and say, am I going to have to go virtual in 24 hours? Because that's what our students face, and it caused anxiety. In the big picture, the safety of everyone is more important than a fake sense of normalcy, the reality of which may be harder for many of our students to handle than virtual learning itself. Thank you.
Thank you. Jill Jonas, you're up again. Sorry.
Our number one priority is to keep kids safe, even above educating them. That's just basic, standard, non-negotiable. And if that's our number one priority, then we have to do that. Infections can result in death. What do we tell students if their classmates die, their teachers die, or someone's family member dies directly as a result of reopening our schools? With rising infections in the state and our community, the odds are this will happen. It seems reasonable to expect that no one should return to school until the federal and state government offers clear, specific policies and resources to ensure the health and safety of students and staff. Asking students and staff to go back in a classroom where we have the potential to spread COVID-19, a potentially deadly disease currently causing a global pandemic, to our school students or their loved ones is asking too much of us. I can't even begin to imagine the pain that would cause me if I was personally responsible for the death of one of my students or their family members. We used to think that children couldn't get COVID-19, or if they got it, they didn't spread it. Besides the already mentioned Chicago study published last week in the American Medical Association journal that examined the concentration of COVID-19 in children, another recently published study completed on 65,000 students in South Korea showed that children between the ages of 10 and 19 spread the virus as well as adults do. This suggests that if we reopen our schools as scheduled, we will have outbreaks like have already been seen in our community, but potentially at a much larger scale. In order to make an informed decision and to protect our students and staff, we have to keep in mind the level of risk that students and staff will encounter if they return to school buildings. The following are the 3 risk levels for school personnel according to the CDC's website as of May 31st. The lowest risk is students and teachers engage in virtual-only classes, activities, and events. More risk, small in-person classes, activities, and events. Groups of students that stay together with the same teacher throughout and across school days, and the groups do not mix. Students remaining at least 6 feet apart, do not share any supplies or objects in school. The highest risk is full-size, in-person classes, activities, and events where students cannot be spaced 6 feet apart and mixed between classes. Also on May 31st, the CDC stated that exposure to the virus by someone who is providing airborne particles in an enclosed space like a classroom over a long period of time increases the danger of infection. The more people that a student or staff member interacts with and the longer that interaction, the higher the risk of COVID-19 spread, because social distancing measures only work when you are in the vicinity of a coronavirus carrier for a short period of time. So students and teachers together in a small classroom during a typical 7.5-hour school day puts them all at higher risk. Given this information, I believe that for at least the first 9 weeks, we should decide to do virtual learning and then reevaluate based on whether or not we have flattened or reduced the curve or a vaccine has been developed. Deciding this now will give teachers the time to process, practice, and implement new initiatives needed for virtual learning. Many of us have been spending the summer learning as much as we can about virtual learning. It's not saying it will be a perfect execution without bumps. It will be new for everyone. But when our students encounter new challenges, we don't tell them to throw in the towel or not move forward just because it's unfamiliar or difficult. We provide them with all the necessary resources, and then we encourage them to persist, be creative, and learn. Lastly, making the argument that virtual learning might not have worked very well for everyone in spring, therefore it might not be the best option, is deeply flawed. It didn't work well maybe because we didn't have time to prepare. We had very limited resources, and it was born out of a completely unexpected national shutdown. It wasn't virtual education, it was emergency learning. If we are given the resources and time, it will be much more impactful and effective moving forward. Give us that opportunity to prove that and keep our students, their families, and ourselves safe. Thank you.
Thank you. Kylie Jones. Just one. She's the last one.
All right, so I'm a teacher at Robert D. Campbell Junior High, and I just wanted to touch on some of the social aspects of education that will change in light of all the changes in our country. So a typical day now for an RDC student is that a student will enter the front of the building to mask administrators and teachers to have their temperatures taken immediately. Many will have been sitting on a hot bus for an hour or more already with the mask on their face. If their temperature is under the 100.4 mark that we've said is safe, they will go directly from the front door to a homeroom classroom. There will be no morning basketball games, intramurals, chatting in the hallway, nothing like that. They won't be able to gather, take casual restroom breaks. All of that social interaction that they depend on in the morning will be gone. If it works like RDC hopes it works and we can be 6 feet apart in the classrooms, which I'm not sure if we know yet if that'll work or not, but if that happens, students will carry Chromebooks of their own, and the expectation will be that they sit still and that they learn virtually. And teachers will become facilitators of that online learning, because as we know, when you get up from a room or from a chair, all the masks have to go on. So if we want our kids to be without masks and we want social distancing to work, nobody can move. So every time someone needs a pencil or a tissue or to throw something away, all masks have to go on. That also means that I, as a teacher, can't circulate the room. I can't use proximity control to manage behavior. I have to sit at a desk in a corner and watch, go guardian, and make sure that my kids are learning online successfully and doing what they're supposed to be doing. At lunch, students will stand in line to receive food, and then they'll be placed 6 feet apart, facing in the same direction as their peers. They will not sit face to face with people that they want to talk to. They will not get to mingle and move around. So this won't be a relief from the already rigid structures of the day. It won't be a relief from the rigid structures of being at home. They will return to their classrooms to resume their in-person distance learning, where their friends aren't within reach and their teachers aren't close to them. We won't be giving them praise in the same way directly as we're looking at their work as we once did. It's not going to be a casual working environment of collaborators and partners that it once was when we were all teaching If the 6-foot spacing doesn't work out and teachers are allowed to circulate as people are wearing masks, for many teachers there will inevitably be a level of fear that's still involved in being in a group of that size for that long. After months of social distancing myself, I know that I'm not comfortable being thrown into a building with hundreds of people. I, as a middle school teacher, and I know high school teachers as well, see over 100 students a day. So I don't know what these people have been doing. I don't know if they went to Florida 3 days before school started. I don't know if they're having big parties without masks. I don't know what they're doing on their day-to-day lives. So I know that I'm at a greater risk in being around these people. It's also important to mention that no business really is conducting business meetings with this many people for this long in close quarters for an entire day. Even the political officials that are urging us to return to school are doing so from the safety of their home offices, most of them. So saying that school is an option because the mortality rate is low for children is ridiculous, and it's also unknown, as has been mentioned by some other speakers tonight. We don't know how many students will die from this because we haven't been in school for months. All that we know is that some will die. Some teachers and some students will not make it through this. And I'm a mom. Some is just an unacceptable number for me. And it's not a risk that I'm willing to take for my own child, who will be in first grade this year. I know that closing schools for working parents is a hard thing to do. I know it puts them in a bad position. And I know that I'm in a good position to deal with the closing of schools as a teacher, and that I'll be able to take care of my kids from home. But if we're committed to keeping our children safe, there's only one guarantee in doing that, and that's to not send us back and to do virtual learning from home. Thank you.
Thank you. Did you need something?
If that's all the public speakers, if you're ready to move on to, take one, two.
Yeah. Yeah, I thought you wanted something,
Okay,
although when you
yeah,
asked me.
I've asked, so for number 2, as a part of our reentry task force that we have here in the district, I've asked Rebecca Kissick from the health department if she could come forward and talk to us for just a few minutes and talk to us about where we are in Clark County with COVID, and what some of the expectations and what we can expect possibly moving forward, and how that would affect us as coming back to school.
Thanks.
Good evening. Thank you for having me. I will share with you, first of all, that this staff, your superintendent, and the folks in this room have worked tirelessly. We began a conversation, actually, I believe, kind of end of February, 1st of March, and began planning and talking about what would happen and where would we go if we found ourselves in this position. I will say to you that this staff has been one of the most proactive and detail-oriented, diligent groups of people I have ever worked with in my whole life. But tonight, I'm going to share with you the information that we know from the health department perspective. With that, I will say, and I don't know if you can switch that slide for me. I don't have a, thank you. Thank you. This information was current as of last evening. We had 227 positive cases. I will tell you today, I'm going to announce 6 more. That was as of 5:30 when I walked out the door. There's no promise that by the time I get back to my office this evening, that won't be higher. I will tell you that and we're going to walk through some of this information, but a lot of people see that active case total and they see 33. But I want you to also understand that of those 33 active cases, I have over 80 people that I am monitoring on a daily basis that have been defined as being a close contact. Those are people that we place on quarantine based upon the exposure through interview that we know they meet the criteria as outlined by CDC. That criteria, or that metric that we use, is within close proximity, so within 6 feet, for more than 10 to 15 minutes. One of the things that I will say to you, as I've heard some wonderful speakers here tonight can articulate, is that I also am a mom. I have 2 kids, and no matter how hard I try to socially distance, my kids will not stay 6 feet away. So as we go through the metric and we ask these questions, that's one of the challenges that we know we face. In addition to this, I will say, and we're going to kind of dive a little bit into just 2 points that I want to make really clear, because I've also heard some conversation about testing this evening. You'll see on this chart that we're reporting probable and confirmed cases, and I want to spend just a second with that. That 183 confirmed cases, if you will flip to the next slide for me, those represent individuals in this community that had a PCR test. A PCR is the gold standard. We are looking at the actual genetic material within the virus, and we can say, without a doubt, this is a positive patient. Now, we've had some really great partners come on board here in Clark County recently, and one of them being the First Care Clinic. First Care here in the Clark County community is actually doing an antigen test, also known as a Sophia test. That is a rapid test. That is a viral test, and we've had good results with it. But an antigen test is not that gold standard. It's not quite the same. So those are our probables. While we believe, and there's good specificity with that exam or that test, we still report those results as a probable result. It doesn't change anything in accordance with the CDC definition. We work that the same way. It is still a positive patient, but because of the case definition, we do separate them out now. In addition to that, what is most important here is this last sentence on the slide. A viral test is a snapshot in time. And this is a conversation I had with a patient today, because the patient was telling me, well, I had a negative test 2 days ago. There's no way I could be positive. What we know about COVID is that the incubation period is 2 to 14 days. That's why when we're talking about a quarantine, I ask for 14 days. I know that the average onset of symptoms in the state of Kentucky is right there around 7 days. But I also know that you become infectious prior to onset of symptoms. So when we say a viral test and we talk about testing protocols, I want you to understand that I could test today, I could be asymptomatic, and 2 days from now I could become symptomatic, I could fall ill, and I could certainly test positive. So please understand that a test result is only good for that moment in time. It is not necessarily indicative of any sort of protective factor. We talk a lot about positivity rate here in the state of Kentucky. Positivity rate, and we're very happy. You've probably heard the governor talk about this as well. We are very happy to hear that our positivity rate has actually fallen a little bit. At this point last week, we were at 5.8%. We're at 5.3% now. However, what I will share with you about that is that Johns Hopkins flagged 5% as that threshold. Anything over 5% is a red flag, so to speak. And that's when you began to see the governor mandating his mask ordinance. He also outlined the travel restrictions. This is what drove that. What we know about a positivity rate is it is a percentage of positive test results of tests conducted. Go to the next slide for me.
Ms. Kissick,
Yes,
was that
sir.
last one, is that state?
Yes.
State or Clark County?
No, that is state data.
Okay.
We're going to look at one more state slide and then transition to Clark County.
Okay, thank you.
This gives you a snapshot of what we refer to as the epi curve in the state of Kentucky. And you'll see it's broken out by weeks, and I'm going to show you mine as well. Here in the state of Kentucky, and this was as of the 31st, I believe, we have reported 30,000 cases. If you'll flip to the next slide for me. These are our case totals by week, and I want to spend just a second here. You'll see we did, and overall, I think we've done a great job here in Clark County. You'll see in early March, we received our first case actually on March 15th. We've stayed pretty steady and we stayed pretty low. We actually had 2 weeks where my staff jokes that it was almost like it was back to normal. And then in early May, we kind of took off. And I want to address specifically the week of June 14th. That week is when we also recognized our largest outbreak associated with long-term care. But what I think is also important is that you're noticing that our numbers are trending upward again. And if you'll flip to the next one for me when we start talking about months. And I should have put the numbers on these, and I apologize for not including that data label. But in the month of May, we confirmed 27 total cases. In the month of June, I confirmed 85. And in July, I confirmed 88. So we are definitely on an upward swing. And what I think is really important is actually included on the next slide. Because you heard me say that that week of June 14th was the week for which we identified our largest outbreak associated with long-term care. However, what I want you to kind of pay attention to on this slide is that that blue line represents my long-term care outbreaks. The orange line represents my community spread. And if you'll click to the next one for me. What this represents, and you will see here, is that now we are at 76 community members as versus 11 associated with my long-term care. You'll see that dotted line is my trend data, and we are certainly trending upward for community spread. What we know, and you will see the health department reports each day those new confirmed cases. And one of the reasons that we began to break that out is because folks really wanted to know, oh, this is just an issue with long-term care. It's not an issue affecting our community. But the reality of the situation is, and it's demonstrated here, we have seen that shift and we've seen it change. What we are seeing now is certainly the predominance of our cases are in the community and in that community spread. You can flip to the next one. We also have seen a shift in the age distribution. One of the things that we knew kind of going into this was that we trended a little bit older in terms of age distribution. And actually, if you flip to the next slide, I think this breaks it down by numbers. Our average age here was, I believe it's 70 years old for a long time. When I separate out, however, my long-term care patients and really look at my community spread, the average age is 37 years. You'll see there as well, I'm reporting 25 of my patients are under the age of 18. Those are what I refer to as my pediatric patients when you see my daily updates or my case reports. We'll flip one more for me. This is actually information that you would have also seen Dr. Stack, who is my commissioner, shared this a few weeks ago, and I know some of you have done a really wonderful job addressing this as well this evening. This talks a little bit about what we know about the long-term effects of COVID-19. But what I also want to highlight here is that we're still really early on in this. So to be able to say that I can stand here and say to you, I know exactly what these long-term effects look like, and I know what it's going to mean, is probably a little premature. While we have identified these trends, we don't know that this is an all-inclusive list. We just know that this is what we've seen thus far. And what I do know is that 1 in 5 young adults will still have symptoms 14 to 21 days after a diagnosis. Recovery in those severe cases can take 6 weeks or more. And that's one of the things that we have seen, especially in our younger patients. Sometimes they start out really, really well, but they have declined really quickly, and then it lingers, and they have struggled. That is not something that we want to see for anybody, certainly not our students, and also not our staff. I think I have one more slide. This is where I will, and this is what you will always hear me say, we really firmly believe that prevention is the best method, and so we believe in wearing the cloth face covering in public for everyone's protection. We also encourage social distancing, and again, want to really encourage that frequent hand washing at any juncture. With that, I will be happy to answer questions.
I have a couple. Of the 227 cases in Clark County, how many are in the Fountain Health?
I believe I have 92 that are associated. That 92 is going to incorporate staff as well, however.
Okay.
So I believe I was right at about 71 patients, I believe.
But 92 staff and residents?
That is correct, cumulative, yes.
Okay. And then, of the balance of those, how many children have been hospitalized?
I do not have that information, and I'll also say to you, I've gotten a lot of questions about releasing hospitalization information, and I will say that early on, it was a decision that I made not to release that because it was an identifying factor for me. I do not have the hospitalization data in front of me, however.
Okay. Since our daycares have opened, how long has that been? A month, 3 weeks?
I believe they opened, was it May 28th, I believe?
Have you had outbreaks there?
We have identified clusters that have been associated, yes, with some child care facilities, yes.
And do you know how many kids are in daycare right now? Do you know? in Clark County?
I do not know total.
Okay. How many of the daycares have the outbreaks?
We have worked with 2 specifically here in Clark County.
Okay. Do you know how many kids they have at those daycares?
So I will tell you that we work that kind of on a case-by-case basis. So for example, if there is a child that tests positive in one classroom, my focus is on that classroom, kind of with some understanding of the structure of that facility. So while I can't answer total numbers for facility-wide, they have ranged. One of mine was smaller, I'd say under kind of 50 based upon that 10 student limit. My other facility was much larger, and I'd say there were probably 80 to 100.
You had 80 to 100 kids that had tested positive?
No, that are total in that facility.
Okay.
Not tested positive. No.
Okay.
No.
I have a question. So I know you've been working really close with our committees, and thank you for that. And based upon your knowledge of the plans that's been put in place and then, continuing to work, and based upon the environment in our community right now, what's your recommendation on opening schools?
I firmly believe that it is in everyone's best interest to go virtual the first 9 weeks. I will always err on the side of public health and caution, but I think the first 9 weeks virtually is definitely the way to go, just based upon the trend data that we're seeing.
Thank you.
Even with today's numbers dropping?
So I will say, let's talk about that for just a second, because that's not what I'm seeing in Clark County. Each county and each community is a little bit different, and I think it's important to also understand the way in which that works. So this data, and many of you may have heard our state epidemiologist presented to a group last week, and he referred to this data as messy at best. And that is true. When we start looking at the information that the governor shares each day, that is information that kind of rolls up to him from a variety of labs and reporting sources. What I will tell you is that it is Monday, and not every lab reports over the weekend, and so there is a delay there sometimes. There's also a delay in, I get a case and I begin to work it, and that's what I report out on. And so those are the numbers that you're going to see from me at the health department. I have a case, I have worked it, and I've identified a person. Sometimes, and we've seen this a number of times, especially when we've reported fatalities, unfortunately, by the time that information is submitted up, and it is on the provider to submit that information to the state, then it has to be logged and entered. There can be a week, sometimes longer, before that actually rolls up to the governor's desk and is available for him to report on. So while we did see a lower case total today, I would always encourage you to pay more attention to kind of the numbers and the trends here in Clark County, because that's truly what you're going to want to watch in terms of what we have going on here.
So I don't know how many weeks it's been since the governor mandated mask usage. Has it been 2 weeks or 3 weeks yet?
I believe, yes, it's been a few weeks, yes.
A few weeks. So we would hope that if people are abiding by that's going to have potentially some non-trivial effect on bringing this down.
Mm-hmm.
And if the incubation period could be somewhere up 14 to 21 days,
Mm-hmm.
I suppose one theory would be that if people are adhering to the mask policy, that is going to have some effect, some positive effect on bringing our cases down. And right now we're easily 5 weeks out from the beginning of school.
Mm-hmm.
I guess I would assert that there's the potential that policy is actually going to do what he hoped it will do and bring the cases down. Is that a reasonable assertion that one could hope something like that?
It is our hope that the mask mandate will have a positive effect. That is certainly our hope. However, I will share with you that from the health department perspective, we have spent quite a bit of time over the course of the last 2 to 3 weeks really providing some additional education and guidance on even truly wearing a mask, when to wear a mask, how to wear a mask, and what that needs to look like. Many folks kind of have maybe not covered the nose or have had it on their chin more of the time than they've actually had it kind of over their face covering nose and mouth. And so I think there's a learning curve with that mask, but it is our hope that yes, it will have a positive impact.
I'm concerned about the 9-week timeframe of what you're suggesting, that we should go to a virtual school scenario. That seems a little long to me, that if the mask usage has a positive effect by bringing the numbers down, and then add to it a little bit of time for education for people to know exactly how to optimally wear masks, that's going to bend that down. And perhaps 9 weeks might be a little aggressive in terms of the amount of time we're keeping kids out of school. Is there some metrics potentially we could look at that you would still be comfortable with to say, let's just say, for example, the board decides, well, let's go ahead and start virtually, and then let's keep our eye on these particular numbers, and tell parents you need to plan for 9 weeks, but these are the metrics we're looking at, and if it hits these numbers on a consistent basis, then we'll feel comfortable bringing kids back into the classroom, maybe on a hybrid basis to begin with, and then perhaps if the numbers continue to go well, on a full basis. Are there numbers like that we can look at, so potentially we're not keeping kids out of what I personally think is an optimal learning environment, absent the COVID risk, which is in-person instruction. So we can bring that 9-week number down to whatever it simply the lowest number it has to be.
So what I will say about that is that I would continue, one of the things that everyone has probably heard me say is that this is a very fluid situation. And it is fluid in terms of we must continue to assess. And when I say that, I think it's great. I think having this conversation on a monthly basis is wonderful. I go back to those time frames when we start looking at 14 to 21 days. If I've got a patient, who may test positive at the end, now we're at 28 days. And those things roll very, very quickly. I think it's important that you continue to look at that information, but what I also want to remind you of is continuing to look at the actual kind of picture or that case origin. Because rather than just setting a metric that says, well, if we reach, 10% of our cases are community, then we would be fine to open. I would want you to kind of ask some questions about what that 10% is. Is that 10% school? Are those kids that were associated with known cases and it's a cluster outbreak? Because that's a very different investigation, or it's a very different perspective than 10 folks associated, maybe that had worked or lived with somebody that works at Fountain Circle or long-term care facility. So I hesitate to tell you to kind of set a hard and fast metric, because I think it's something that is going to depend more upon a true understanding of the data of the community and kind of where we are at that moment. I think assessing it on a monthly basis is great, but having a true understanding of what the data looks like and what it is important.
So there's no magic number that says this is our benchmark to get our kids back in school. There's not that number.
Not in my opinion.
So how will we know when we can get our kids back in school?
So I think one of the things that you're going to really want to look for, first of all, is a decrease in cases. I am hopeful that we're also going to have some of those precautionary pieces, such as the vaccine, soon. But I think it's also going to be something that you're going to need to understand. We've seen a case level drop and or hold steady, but we also have an understanding of who's being affected, and it's not going to affect our teachers, our staff, or our students. And that'll be a discussion that you have to have on an ongoing basis.
Just out of curiosity, on the numbers that you saw when they started to increase, had a lot of those been out of state?
We've had a decent number that have been associated with either travel, yes, or the cluster outbreak associated with a camp. Okay. But I would say, we are also seeing a widespread kind of community outbreak or community spread at this point. That folks maybe don't have travel, they can't associate it with kind of one particular point, and so we're seeing a spread as well. But yes, there are a number of cases that are associated with travel, whether it be the cluster outbreak that we had identified or vacation.
Does your department have access to physical, sexual abuse of children, nutrition issues, mental health issues, drug overdose or drug abuse issues, juvenile crime? Do you have that and know how that has been going within the district?
So what I will tell you is that while we serve folks impacted by those things that you just listed, that data is not maintained by the Department for Public Health. It's going to be through the Cabinet for Health and Family Services, Department for Community-Based Services, and I wouldn't want to speak on their data without having it in front of me.
Who's the contact person? Do you know?
I do not know, but I can find that for you.
Thank you.
In case we forget to say it, we really appreciate you coming by. And we very much appreciate everything you and your staff have been doing to keep our community safe. So we're doing a lot of thinking, but I want to make sure we thank you while we had you here.
Well, thank you, and we are more than happy anytime to answer any questions. You know, one of the things that we try to be as transparent as possible, and so each Monday we release an infographic that gives you a snapshot of cases in the community and cases kind of here that we're seeing in Clark County. It provides you with an overview of that trend data in addition to the daily updates that we provide. So if there are questions or there's additional points of clarification that you would like, please don't hesitate to reach out to us either.
Thank you.
Thank you all for your time.
Thanks.
Okay. With that, Paul, did you have anything you wanted to add or any recommendation? You want?
Ready to make a recommendation, that's what the board wants to make, a recommendation, I'm ready to make a recommendation.
What's the superintendent recommendation?
My recommendation would be that for the safety of the staff and students of the district, that we would utilize the NTI/virtual instruction for the first 9 weeks of online courses for all of our students in Clark County, with the opportunity for the board each 30 days to come back and reassess, and if it means bringing back Ms. Kissick back in to share this data with us and go over that, but to be able to look at it. But I think there is, at some point, there would be a possibility maybe to come back, maybe before the 9 weeks, I don't know. But I'd like to have that opportunity to share the information with you all so we can together make that decision. But in my opinion, at this point in time, I don't think we're ready to bring kids back in on a full-time basis.
Well, I'd like to make a motion that we approve the first 9 weeks of going to NTI with 30-day assessments thereafter, starting in September.
Okay. Motion by Mr. Talby. I'll second that.
This will be our opportunity for discussion.
Yes.
Mr. Christie, if we went to an NTI model, is there any reason now, under that scenario, to wait until after Labor Day? Can we go ahead then?
That would be a board discussion, that's totally a board decision because of the calendar.
And the calendar's not on the agenda. I don't know that we can even discuss that, can you, Brian?
You could just, I guess there can be some discussion, but you won't be able to make a decision. You would have to, if it's in conjunction with going to virtual or in person, you can have that general discussion, but you can't take any action on changing the calendar.
Okay.
It would seem to me like if we go down the path of starting with virtual instruction, then we don't need to wait till after Labor Day, perhaps.
That would be dependent upon the attainability of the laptops we've got on order. There is some discussion from this company that we ordered from back in June about delivery times. We have since located another vendor, teamed up with Fayette County and going through their vendor and have some options there that we can get some in probably in a much quicker time that would meet the, certainly would meet the September 8th deadline. The other thing is our online platform, the school's PLP program that we're just beginning to start our professional development for our staff. Our principals have looked at it. We've had team of teacher leaders throughout the district that have looked at it. But we're ready to start rolling that out now to do that. I don't anticipate that would take more than probably a week or 2 weeks district-wide to do that. However, I would want to ensure that there's time, as some of these teachers have talked about here tonight, that This is a different platform. This is not what we did last year. This isn't the teachers preparing everything. This is working with a platform that has the classes, specific classes. It has all the materials to be presented. It's aligned with the Kentucky standards. It has pacing guides. So there's going to be some instruction, and these teachers are going to want to look at it and work that in. Now, it also has the ability to incorporate our own programs and things that we do, and it's all launched through the Google Classroom. So there was some question about the safety of teachers working online, individual students, and somebody being able to say something inappropriate was said. Just know that that's recorded, that's kept. So that's able to be pulled back up anytime. Any dialogue between teacher students is all stored in the program. So there's that safety feature there. So that enables us to work for the teachers to work with kids as whole groups, small groups, and even individuals. And I think in this next 30 days before we start, there's going to be a lot of discussion. I want to be able to have the ability to, through this platform, work with the teachers and develop the understanding that as it progresses through, if there are students that lag behind, we can monitor that on this program. We can monitor daily work with the students by the hour of what they're doing. And the teachers will have access to doing that. Like the ability, I think, to be able for the teachers to work one-on-one with those students. In the area of some of our special needs, there's going to be a need for one-on-one in person, which will require some social distancing and things that it's unavoidable by the law. We have things that we have to meet the obligations of the laws we do. These folks that work with these programs know this, so we're working through that. At this point, it's getting the program in the hands of the teachers and giving them time to start developing those lessons and getting out ahead of the game, so that when those things go out, they're able to monitor the students and work more directly with those students. There is no program that will take the place of that teacher standing in front of the students. There's none out there. But this is a way that it puts the class, and I might add that this program not only does your core content classes, but it also does your related arts classes. There are classes at the high school that we're going to have to cancel because we probably can't do those virtually. But in this program that we're looking at, there are other classes that we can pick up to offer in the place of those that teachers will still be certified to do. So we have an opportunity with this program to offer some new classes that we wouldn't have had up to this point. So if there's any bright sides to this, that's one of the good pieces of this. There's some opportunities created there. I think as we move further down the road and we work with the health department, we see some changes. There's going to be the opportunity, maybe if we don't bring everybody back at once, maybe we start to bring specific or individual classes back at a time, and we can spread them out. Maybe we bring back, it's very important in my idea that we work with those young kids. There's some things that we've got to do a lot of work with the young kids. There may be an opportunity as we move forward to bring some of those, start to bring those back when we start to bring groups back. I might add this program, what we were doing as we ended the year last year, we weren't going to be able to do kindergarten, first or second grade. This platform that we're introducing right now it goes preschool through 12th grade. So now with this program and working through Fayette County to be able to pick up some additional laptops, and we'll work on that ourselves here. That's not something that we can do this. Provide those kids with laptops, so now those teachers at kindergarten, first and second grade, and those students have the same opportunities that our second grade through 12th grade have with the online platform, and those teachers are working the same as those third grade and above teachers.
So I just want to be clear and hope and make sure it's clear for the community too. And we've discussed this been contacted by some special need parents as well as some parents that have very young children. Even though we plan to, if this is approved, we plan to go to NTI, the schools are still open.
Yes.
So it'd be up to the teacher, student, and parent to work together on if they need to do in person or if they're lagging behind or if it's a special needs. So just because we start down this road doesn't mean that if it's basically case by case basis. I understand that, but they will have the ability to work with teachers to accommodate students.
Yes.
So what will the student's day look like? Take a 12th grader in science. Will he log on at 10 o'clock Monday, Wednesday, Friday to do his science class?
Not necessarily. That depends on how it's set up at the school. It could be that it's set up that way, and the teacher may choose through the Google platform, they may choose to
a specific time so that they can look at the students and they can communicate back and forth with the students via telephone or via online type thing.
So it's gonna be
But
more
it's not going, we can do it through Google Classroom. There can be some virtual online teacher-student communication back and forth. But it's kind of the program is so for students to work at their progress. The teachers
So it'll be up to them to get on
the
at their...
teachers can monitor it.
Okay.
And it can be at any time of the day. Our plan is also, it's been since March, and I hope our staff understands, we've tried our best to accommodate anybody with any kind of concerns with this, and we want to continue to do that. And I realize, as spoken here tonight, there will be some who will not be as easily adapted to working in the classroom as others would right now. With those, I think we're going to have to take those on an individual basis. We know that this is virtual. We know there's opportunity to work with those teachers virtually, even to the point of talking with the principals. I would like to create the opportunity for some of those working virtually from home instead of working a normal, and I'm just picking the hours, 8 to 4 for a school day. But some of those that are working virtual as a not as a trade-off, I don't want to put there, I don't want to hold it over somebody's head, but it's something that we'll work with somebody if there's a special circumstance, but maybe in that such special circumstance, that person can even work maybe a 12 to 7. So after hours, after school hours, there's some contact still that these folks at the schools, and that's something we could publish that there's somebody that they can contact even after hours, because it's not always the student that contacts the teacher that needs help. It's a lot of times it's the parents that contact the teacher that needs help. And parents, a lot of them working during the day, and it makes it very difficult if teachers are only online during the day. With this, we can stagger some schedules where we would have some folks available at each school of an evening to make it better for parents. Now, with this program, there is a parent training. It's a small piece. It takes about 15 to 20 minutes for the parents to go through. That's another thing that's the beauty of this program is that every student from kindergarten through 12th grade accesses the platform the same way. So if I've got a student in 1st grade and one in 5th grade and one in 9th grade, I don't have 3 separate platforms that I'm trying to figure out how that school's navigating. It works the same. And the teachers can supplement the programming that comes with this, even though it meets all the Kentucky standards, it's lined with the standards, they can still add their own materials to supplement that.
Mr. Christie, is this change and/or addition to the school's PLP curriculum, is that a board level decision, or is that something that can be made from the superintendent
I think
yourself?
that's something that can be made from the superintendent. We've got various programs throughout all the schools that are curriculum decisions or the school level decisions.
Is there any cost that's associated with it?
Yes, it would be done through the code. We've already looked at that. The COVID money is federal money, and that's under the superintendent's direction now. We did put the computer thing out there to you, and I did put the graduation piece, so you all have kind of voted to allow us to do that. But this is federal money, but just like Title I money or anything else, this is controlled at school level and the district level. So we're working on the funding for that. And it is in the budget we turned in. We've already budgeted for it, and the budget's been turned in and it's approved. Insurance is signed on it. Cares that. I might add too, this isn't a program that's going to be new to Clark County. I can tell you right now, if you start down the interstate, I can tell you my area group of superintendents that we meet. There's Brown County, Bath County, Menifee County, Fleming County, Montgomery County, Urban, and I'm not sure how much further east we go from there. But those are all going to be on the same platform of learning that we're talking about here. It's been used in multiple counties. And there's a great benefit to that because of purchase power too. So per person license, and we're able to cut that by about 75% when we go in and take sourcing. Madison County is also looking at it. Madison County's got a similar platform to this that they've already had in place for 7 years. And in my opinion, it's going to be difficult for them to change something that they've been doing for 7 years.
Your recommendation was 9 weeks of NTI. Do you know Do you recall off the top of your head how many weeks Jefferson County, Fayette County is committed to at this point in time to virtual learning?
I mean, I'm sorry.
How many
What's
Jefferson
Fayette County,
are they?
Jefferson County committing to in virtual learning?
I don't think, I'm not sure, because nobody's been allowed, up to this point, no school has started up to this point, and won't be starting until after the 24th or after, so nobody's in session at this point. The governor basically shut down all schools until the 24th.
Would it be beneficial for us to do another survey to see how many parents would be willing to send their children to school and see where our numbers, and updated numbers, maybe those that are comfortable could come to school and it would allow for social distancing, and those that are uncomfortable could do the online version?
Well, that's kind of where we are right now. I mean, that's kind of where we are right now. We know at the last, and at that last one, it was about 63-37 is what it was. That we did that survey at a time. It just happened to be at a time, I think, that we were probably at a low in numbers, and I think that may have generated a few more comfortable coming back that time, maybe more so than we would be now. I can't speak for the parents, but we're back up now where the numbers are up, and my guess would be that there would be some differences in that survey, and it would look different than it did before. However, I might add, then that would kind of take away, and we'd be back into the same situation we are. We want to have a host of teachers in the building and kids in the building at the same times. And then that puts teachers working two platforms. I mean, we can do it, and that's how we're going to have to come back eventually. That's how we're going to do it. But that was one of the reasons for my recommendation was this time to get this platform kicked off and get everybody strong and do this online and do it well, so that everybody feels good. And then as we start to move back, if something happens and we have to bounce back and go back to this, everybody's comfortable with it.
Well, and I think from our last meeting, the reason we have this special meeting today, the reason I think I even made the motion for this special meeting, was the question was asked, how long should, that you all will need as administration and teachers and parents, what would be a good time frame on picking the direction going forward so everyone can plan appropriately? This isn't the best scenario. We know it's not the best scenario. I really want to have kids in classroom, but with the increase in cases and right now, there's just no way that I could vote to go in classroom. But with with 30-day assessment, from between now and say middle of September, hopefully the masks work. Maybe there is a decrease. Maybe we can shorten the 9 weeks. But I think we just need to have a direction for the parents and students right now, so that the teachers can get to use this new platform. They know how to use it. They have a much better time frame instead of 2 days or 48 hours or however much you had in the spring to try to put something together. So I think we owe it to the teachers, the students, and the parents to give them some sort of.
That was my thought when you mentioned it the last time, that I'll say this with a group of teachers, I'm not as worried about the teachers, because the teachers proved to us last year that in a 24-hour turnaround they can adapt.
Yeah.
They will be, with this platform and with 30 days to get there, I have all the confidence in the world that they will be as strong as they can be and be ready and prepared for kids and learning in this particular scenario. I'm not worried about them. I just felt like we needed to give parents some time to think about it.
You might want to read.
I'm getting some no's probably shaking back there. Maybe, I don't know. I just felt like we needed to give parents ample time to prepare, because this does affect people in their households, and I know that, and that's tough.
And this new curriculum, if and when we go back to the school, and hopefully that's soon, face-to-face, that's the same curriculum we start with going throughout the whole school year. Is that correct?
It could be, yes. And teachers in person can supplement it in any way that they need. They can use it as is and use all those pieces as are. They can supplement it in person, or they can supplement it online also. There's one other important piece to this that I didn't mention. And I think Mr. Peridot was alluding to it when he was talking to Ms. Kissett. The students that we know right now, we've got kids that are in difficult situations at homes. We know of a lot of those kids right now. There is a social emotional piece to this curriculum that works with counselors, psychologists, and all of the partners that we've taken on in the community that work with those kids. And so that they're, in addition to what the teachers are doing with the students and their curriculum piece, these counselors and these others that I mentioned, they're working with these students and the parents on these other things, making the contacts there, even down to how we're going to deliver our lunches. We're looking, trying to put eyes on kids as much as we can. Now, if we know that these are situations that we've had to deal with in the past, and all of a sudden a student stops working online and we can't make contact, there are processes that we can go through to do checks on those students. And that was very difficult the last 3 months of school last year, because some of those things weren't in place, and some of those now are in place. So I feel a lot more, we're even to the point of looking at taking an additional bus like we did with our food service and our reading bus. I don't know what we'll call it. They'll be more creative than I am for a name, but we want to make it one that our counselors and our psychologists and our other folks in the community that's helping us with those things have, that we can actually do a mobile unit with that, where we can go out and do visits and have kids come on to there and work with and see.
Just one other question, and if I don't ask this, I'll get a bunch of calls. And this may not be up to the district, maybe up to KHSAA. What about the fall sports? How would going to NTI, would that affect fall sports for, right now, or is that more of a KDE or any?
Right now, we're still operating on our athletic programs under the premise from direction from KSHAA and CDC, and that they're groups of 10 or less at a time, and no more than 6 hours per week per group. And there is no scheduled practice other than social, emotional, and conditioning that's allowed to take place now. Now, the KSHAA Board of Control has set August the 24th is the day that we can actually start practices with more than 10. Like say in football, they can bring in more than 10 and they're allowed to wear helmets the first week. Second week, they could wear helmets and pads. The third week, then they can go in full gear, and there's no competitions in any sport with the exception of golf at this point that's to take place before September the 11th. Now, they've set that program. That's still kind of in limbo. Even some things have happened since that at the collegiate level. I think they're watching some other things. They're going to have another board of control meeting prior to the 24th to determine how that looks moving forward. We know that they've cut the football season short a couple. They're down to 7 games. We know that volleyball is going to be 26 matches. We know what soccer. They've set parameters on that. Now, if they hold to that, that'll be determined at their next meeting. That was just a program that they put out for consideration, that they're waiting to see what the numbers dictate at that time. I don't know what that's going to look like. There's been no conversation whatsoever, and they won't even entertain any questions about public attendance to that. They've addressed golf. Golf can have 2 people, their parents, parent or guardian. If they need a caddy, it's got to be one of those 2 people. So a parent, mom or dad or guardian's got to carry the club. They can't ride carts. There's all kinds of other rules. So golf is the only one, because it's such an individual thing, that's the only one that we're allowed to move forward with. And they've allowed cheer tryouts because that can be done individually, and they've allowed dance team tryouts because that can be done on an individual basis. No team coming together, just individuals.
But the NTI, going to NTI does not affect that at all. It's a separate decision.
KHSAA stand right now is if the student is enrolled in your district, that they can participate in athletics and move forward. And they said that does include virtual or in-person.
What?
Can I address something, Mr. Peridot?
I guess.
Mr. Peridot, I checked on those numbers for the abuse, neglect, during the period March, April, and May, when the kids should have been in school but they were home, the occurrences of neglect, abuse, dependency were significantly lower than they were in comparable years for those comparable time frames. So just because the kids were out did not necessarily relate to a increase in dependency, abuse, and neglect cases.
I think what's been addressed by that I've seen nationwide, it's the fact that most of these kids report these things to their teachers. And
That's
the
what it goes
teachers
on to
report
say.
these on, and I think what you see, and that's why I'm asking about in Clark County, what they've seen nationwide is a drastic decrease in the number of incidents being reported. And that's kind of what I was wanting to get at the same thing, because we know that the safest place for a child is inside school. I did read recently on the CDC, of the 80%, I want to think, of children, not 80% with mental issues, but 80% of those that do have mental issues. Most of those services are provided to them by the school.
Well, actually, the numbers.
Christie alluded a little bit that we will be addressing some of that, which is good that we do, but we cannot overlook the fact that there's going to be situations that are not going to be taken care of because a caring adult that they see every day is there to report that. And I don't know how that's being done in Clark County, but I do think that would be a good thing for this board to know.
Well, actually, it's good that you brought that up, because I thought you were talking about what happens in school. In the summer, when they're home, we have had the 2 highest reports to the cabinet of abuse, neglect, and dependency, which is really a refutation. I mean, it refutes kind of what the state or what the national standard is, because at least in Clark County, it says it is actually higher in June and July. The reports have been more frequent. And in fact, in the month of July, there were 20 more reports than there were in July of 2019. And those are being done while people at home with not. So at least in Clark County, the kids are reporting it to either law enforcement or some other adult. So
some of them are. We don't know.
Or you got more
that's the
adults
thing.
at home.
We got the missing piece right now. I mean, I don't think there's a right way, wrong way. I just think that any way we can address that, I think we need to. Also, Mr. Christie, the way that I understand schools procedures, the way it's always been, is that the superintendent has the authority to call off school anytime they believe that there is a safety situation at hand. Because my question to you, if this board rejects this, do you think that it's unsafe enough to where you would go ahead and call off school?
I would certainly hope if the board rejects this, that we would come up with some other alternative that we would agree on.
Well, what I'm saying is that
in my
your
opinion,
recommendation right now is to call off school because you don't think it's safe. Now, you are privy to more information than what we're privy to. What I'm saying, if the board rejects the virtual learning of the NTI, are you prepared to say that we will not be having school on August the 8th and going to NTI?
It is my opinion that the time is not right to come back to school, and it's not safe to bring all of our staff and all the students back.
But you would be prepared to make that statement?
I'm making that statement.
You make that statement right now?
The board would support that statement.
Okay. So in other words, it's not a recommendation, that's what you're saying you're going to do. I mean, I understand you want the board support. I'm not saying we won't support you. I'm just saying you're saying,
well,
I'm trying to get your level of confidence that you're doing the right thing.
If this were some other flu or something, we were looking at these kind of numbers, I would be saying wholeheartedly, it's not safe. Yes, I believe it's not safe.
With the flu, you would say that?
If we're looking at 35% of our students not able to come to school, I would say.
Well, that's not 35%. That's not 35% that are sick. It's 35% are not coming back.
We got 35%.
There's a difference in that. I mean, when the flu's out there, it's normally about, if we got 15% of our kids that are sick, we would stop going. But what I'm just trying to do is get your level of how unsafe you think it is.
So with 20 children that have it, we're saying that we're uncomfortable coming back to school with 20 kids that have it.
Right now, based on all the information we've gathered and what we've heard, I would be very uncomfortable coming back right now with anything other than what you have on the floor right now at this point in time.
How does the 30-day revisit scenario work? So, we're sitting here on the 3rd of August. I believe the current calendar says that school would resume on the 8th of September, and adding 9 weeks to that takes us out to November the 10th. So if we think that greater incident of mask wearing is going to help improve things, how will this, how are we going to have the ability every 30 days, how's that mechanism going to work in the hope that maybe we could bring our students back before November 10th?
Two ways, in my opinion. You have a regular scheduled board meeting, and you have the opportunity to do a special call at any time.
Okay, so if we see things that the community are really turning around for the better, then essentially then we as a board can say, it looks like we can revisit this, and the 9-week NTI schedule that we thought we needed, now we think we'll be able to come back at X sooner date. And essentially we do that at any time, is bring them back into school whenever.
I would
it looks
hope
like
that
it's
when that
safe.
discussion happens, that there would be a period of time that would give parents time to adjust to that. I don't think if you come in on a Tuesday night and say, the numbers look good, I think we can come back, let's start back
Tomorrow.
or let's start back Monday. I think there would need to be a period of time because the teachers going to have to make some adjustment. There's going to be some things that have to be adjusted. And we need to prepare for whatever that coming back looks for, whatever number that's going to be.
The motion that says, right now that's on the floor is for the assessment start in September at the board meeting, regular board meeting in September. And if I did say regular board meeting in September, I want to amend that.
That's the 27th, I think.
And he's updating it every meeting right now, whether it's a special meeting or he's doing an update. We're leaving that on there so he can keep us updated on what's going on. And as far as calling a special meeting, I hear from Paul at 8 o'clock in the morning, 12 o'clock in the afternoon, 1 o'clock, 2 o'clock, and in between Arlene calls, and then I hear from Paul at 11 o'clock at night some nights. He's constantly giving me numbers and updates on what's going on, and so he can call. The special meeting's not an issue if he needs to call a emergency special meeting on that.
So, Mr. Talbot, let me make sure I understand what the implication is of your motion. The 9-week time frame is in there, but that we would revisit this no later than the first regular board meeting in September, and so that's the motion, but that wouldn't preclude us from revisiting it sooner.
No, it would not if the numbers, dictated that and a special meeting was called.
Okay.
And everyone agreed to that.
And then going down that logical path, tying in what Mr. Christie said, let's say that the numbers did get better, we revisited at the point in time, said, all right, looks like we're doing better, so now at X point in time in the future, 1 week, 2 weeks, 3 weeks, or whatever, we're going to switch to, now we're going to, bring some students in under this new scenario. Give people time to implement it.
Yeah, the intention is to have it on the agenda for each board meeting, okay? So that we at least can discuss it, reassess it, and see if it's feasible to come back sooner or if we have to extend it.
And then practically, we would give parents and staff, some time to implement it, so it wouldn't be on an immediate turnaround basis.
Right. Thanks for clearing that, Bill.
Ms. Ritchie, there's a motion?
Oh, you want to go ahead and call for
Yes.
call for a vote? All right, we will call.
Could we have a motion? I want the wording in there to utilize, I would like, if it's okay,
Let's read it back.
to utilize NTI and distance learning.
Yes.
Because distance learning is a form of NTI. That's the form of NTI. NTI can also be used if we have a snow day in there too, that might not. It means two things.
And could I get clarification? And that doesn't preclude on a case-by-case basis, if you need to bring students into the school for special scenarios, special work with teachers.
You did say
it doesn't preclude that, right?
Yeah, we talked, yeah.
Okay, I just want to clarify.
Yeah, that's not, I don't think we need to make a motion for that, but that's part of it.
Parents and teachers.
Okay. All right, so, are you good now, Paul? Arlene, good? All right. All those in favor, say aye. Aye.
Aye.
Opposed?
No.
No.
Motion carries 3-2. All right, so moving on to item, or does anybody need a break? Come out of your mask, go outside and take a breather.
Is it
Okay,
going to take that much longer?
No, we won't take it. No.
okay, just making sure. What?
Was that Richardson, Peridot, no?
Yes, Richardson, Peridot, no, Heisel.
Kind of hard with the mask.
I know, that's why I didn't
See
know.
where it comes from.
Okay, item number 3. You keep putting my name on these. Emergency reading of interim policy updates. And it has my name, and Paul, you can go ahead with that one too.
I'll probably let Mr. Mr. Thomas talk to you about this. We normally do our policy updates in May, June. This was one, however, that did not, because Kate, SBA, and some of the others was involved in some litigation on with this particular policy. They've got an interim, and I'll let Mr. Thomas explain it. This is to replace that. It has to do with Title IX, not the Title IX in the sense that we're used to talking about. It's more with sexual harassment and those type of things. But they were still in litigation on that policy and straightened it out. That's why it was not in our policies to correct this last time.
And they still are in litigation, but what has happened is there is a policy, an interim policy update as it relates to sexual discrimination. One, as it relates to certified personnel, another as it relates to classified personnel. Those were set out, and you can see they were kind enough, KSBA was kind enough to go ahead and highlight the respective changes as it relates to reporting, what is the scope, the prohibition of sexual harassment, setting forth a grievance procedure, and since these are emergencies, we are not voting on them. We are just reading them to let, for compliance purposes, all we have to do is be able to identify that we have presented those policies out there, and they will immediately take effect. Then we can, I think there's a procedure that goes along with that as far as the grievance procedure and how those rules would apply. So that's what numbers 3 and then subsequently number 4 are going to be. So no action has to be taken, we just have to read it. I believe that's correct, isn't it, Arlene?
Emergency reading, and then the administrative.
Right, yeah. So there's no vote, just like I thought. So you just have to Ms. Ritchie, just go ahead and identify that we have conducted an emergency reading of the interim policy update as it relates to the sexual harassment Title IX.
Now what, you want me to read all that back out?
No, you just have to, I'm just legal counsel, you're actually the chair, so you would actually.
Okay, we just need to acknowledge review of emergency reading of interim policy update.
As it relates to sexual harassment in Title IX.
As it relates to sexual harassment in Title IX. That's all you need me to say, correct?
That's correct.
You're saying we don't have to prove anything?
No.
No, I just had to read that stuff.
It says the requirement from the policy consultant at the KSBA just indicates that we just have to hold an emergency reading and there is not a vote. And then secondly, the administrative procedures only require one review and not approval by the board. So, but there can be an opportunity to make comment.
If I said that, it kicked me off online and everything. So I hope you don't need me to read anything else out loud, because I've lost everything.
No, you're good.
Good, because I'll have to go with the sharing. Okay, so that's all you needed for item number 3?
That is correct.
All right, so we're on to item number 4. Does anybody have any more questions about item number 3? Scott, you good down there? All right.
I think on that policy, if you're sure, I'm okay if you're sure, but I was under the.
We just have to have one reading.
We have to have an adoption date and an order on that policy, the interim policy.
What they sent me says it just has to be one reading.
Our legal counsel and our civil attorney.
Well, that's what they have one reading normally.
Every Monday. Have another meeting next Monday anyhow, right?
Yeah, it's our weekly.
Give us something to do on Monday, keep us out of trouble.
If y'all will bear with me, the KSBA email says we just have to have a reading. So we're going to find out because we're going to check our own policy.
Nobody ever wants to listen to me.
Approve the thing.
They'll learn.
No.
We have to approve a change.
They ain't learned in this, in 8 years.
Seemed like the emergency part would keep you from having to do it too much.
Can't do anything about it anyway, though, because we can't change the agenda. So,
Ms. Ritchie, if we can, just to cover it, if we could just go ahead and make a motion to adopt.
can't.
Yeah, make a motion to adopt item 3.
Can you do that when
It's
you
a
don't have
special-
it in the, on the agenda?
It is.
We don't have
It's part of the
approval.
emergency reading.
It don't,
Under our policy, 1.015 says, the enactment of the policy will be, in an emergency situation, the board will not enact or revise the policy at the same meeting that is initially introduced. Additionally, additional readings would be required if the board decides to amend that policy.
This is the policy that they're recommending as the interim, and it has to be approved before the 15th, we don't need to set it.
I know, but it's still not on, it just
It's not-
says
yeah, it's not on the
emergency, it's
agenda.
not on the agenda, approve it.
Then if you want to set another meeting next week, we'll come here next week.
I don't.
Did I want to set another meeting?
And you have to have it approved by when?
August the 15th.
If we could do a Zoom meeting.
Yeah.
Oh,
Or
yeah, we could do,
Google
can we do
Meet.
Zoom? I mean, Google Meet?
Probably.
For that?
could. No, August 14th. August 14th, it has to be approved before
I mean, I
August
can
the
do Google
14th.
Meet, whatever. I don't want to come in.
I don't want either.
We don't want to come in just for
Told
that.
y'all we should do that. Can't you read my lips?
Read my lips.
I can come close to reading yours, Scott, they actually move.
You look like you're about to eat your mask.
Yeah.
I mean, if we have to have a special meeting, what, we could just do a Zoom
That's
meeting
what
for
I-
this
yeah.
one item.
And I don't think that's
Arlene's the boss. We go with what Arlene says. Okay, while they're figuring that out, we're gonna take a 5-minute recess. And our attorney and the boss over here at the end is saying 2 different things. Paul's just stuck in the middle. Tomorrow night, 8:30. You good? Okay. All right, we are back in session at 8:33.
For weekend?
No, he can't.
Huh?
It says inclement weather.
Okay.
It says he can't be.
I mean, it says that there has to be.
So, item number 4, we're just gonna skip item number 3. Item number 4. Review of interim procedure updates.
That takes no vote.
No.
That takes no vote. We just have to
I got the snow
send
part.
that we reviewed it.
Right.
I'm sure it's here somewhere.
That's just
I've gotta get my thing pulled back up here.
Procedures.
There's number 5,
Procedures.
Chromebook, here, but we want my agenda.
Uh,
We want my agenda.
yeah, but don't we still have to acknowledge item number 4, don't we?
And, just in the bid, there's an active shooter, there's anything. They're all.
Are these two down here on the end with us?
As far as review, no.
Do they realize we're back in session?
We're researching.
Huh?
We're researching.
Okay. Are you all good with number 4, review? Yeah, review of interim procedure updates.
Vague, but I mean, I think that's what it comes from, that there has to be procedures and procedures.
Okay, is everybody good? Are you two good?
It's always, yeah, I'm good.
All right, item number 5. Consider approval of student Chromebook, one-to-one agreement form. Justin.
Hopefully you all had a chance to look at this, student agreement terms. There's a couple, there's an initial copy, and then Mr. Thomas was good enough to look at it and fix my lack of legalese. And this should be and added some legal talk to it that made it more official sounding and held the people responsible that needed to be, or that not responsible that didn't need to be. Just going through it quickly, it's just the terms of agreement that students and their parents, if you look at the last sheet, the 6th sheet is just a sign sheet for students' parents. Going through it quickly, it just lists the goals of this one-to-one Chromebook project, student guidelines, what they should not do. On page 2, just a general process for reporting issues. Page 3 and page 4 give 4 different options for how repairs would be paid for. Page 5 is guidelines should students choose to use the Wi-Fi at local businesses, churches, civic organizations. It's something I reached out to and I've had a lot of response. Both myself and Mr. Christie have had good response from local businesses, organizations, churches that want to open up their Wi-Fi in various capacities to let students who don't have great internet or no internet at home use their facility. So some of the guidelines there are the guidelines that would hold the students to their expectations. And then the 6th page, as I said, is the sign sheet. So what I'm asking from the board is actually 2 things, but if you wish to finagle it into one, I'm sure you could. It's one is just to approve the document, and 2, more importantly, is to approve one of the 4 options on pages 3 and 4. It's the way that repairs will be paid for. Option 1 basically is a flat $20 instructional fee that every student would pay. It would cover accidental damage to Chromebooks. It would not cover, obviously, intentional damage. None of the 4 options would cover that. The student or their family would cover that. Option 2, and before I get into each of these options, I will say that each of these different options come from another school system. Like, none of the 4 are totally my own doing. So I've just kind of like culled different responses that other districts have done. Option 2 is just a fee based on accidental damage. It doesn't matter what the accident is. You just pay that fee if it's your first, second, or third damage, or you would pay for the cost of a charger if you lose that.
Option 3 is a combination of 1 and 2, where students would pay less of a fee, maybe like $10 instead of $20, but then they would also then pay the actual damage should that incur that damage. And option 4, some districts around here are doing is repairs are just made, paid for on a case-by-case basis. So if something breaks and it costs $62, that family pays $62. If it only costs $10, they just pay $10. Obviously, if none of those 4 options suit the board, obviously welcome to any suggestions we can make. We don't want to put this off too long, but at the same time, we do have 4.5 weeks until school starts. I can prepare something else for the next called meeting, regular meeting, if you all see that something that needs to be edited or added to along those lines. I'm happy to draw it up, have Mr. Thomas look at it again, and submit something else for the next meeting in a week or 2.
My only concern with option was doing a fee is these with large families within our district. I mean, that comes to a lot of money when you have, is there a way to do it where if somebody's got 6 kids in the district, they're going to have to pay $20 a person, a kid?
If you're free and reduced lunch, don't you, fees are waived? Is that?
They could be.
Is that, I always thought that was a requirement.
If they request that, yes. And in some cases, families would want, and they'll want to make good with it, but that's always an option. If somebody can't pay, then they're under the free and reduced. It's not going, none of these would affect them anyway.
Right, yeah. They would still have to pay for repairs, correct? I would think they would have to pay for repairs. I know in textbooks at one time, now I don't know how it is, you may have got a free textbook, but if you tore it up, you were responsible for paying for it. So I'm assuming it's still like that. I don't know.
It's just difficult to collect.
Right, but it's might be difficult to collect the other too.
That's why we got the signed agreement. So that's
Right.
why we wanted this in here. If they sign the agreement, then we got a little more, got some more teeth.
But I guess to address your concern, actually, option 4 is you don't penalize everybody. If you break it,
It's
you
your
pay for
puppy,
it.
yeah.
That's it. Whatever it costs, it's what you
It
pay
may
for.
cost you nothing.
Yeah. Because we do have several large families in the district, and you start getting into a lot of money.
So when I first looked at these options, I guess I took it that this would be an option for the parents to be able to pick option 1, 2, 3, or 4, whatever fit their family the best. You're stating that we have to pick which option for the whole district, or could we, when they pick up their Chromebooks, actually let the parents opt into one of these options? Or is that even feasible?
That would be a nightmare keeping track of, wouldn't it?
Yeah, that would be difficult, at least to keep track of all 4. I could see maybe narrowing it down to 2.
Okay.
Each school will keep track of their own. And this form is, obviously there will be a paper option, which students can fill out and hand in on whenever they're back to school. Most schools are doing like a back to school open house when they will get the Chromebooks. I'll also make this form completely online, so parents don't have to fill out anything in paper, and schools don't have to collect and manage that paper.
I don't know how much of a nightmare it would be. You'd have the student's name, parent's name, which option they chose, and the only time you need to go to that spreadsheet or that information is if the laptop was damaged. Correct?
Correct. I see what you're saying.
But I don't know if you base like on this first option, the $20 would pay, if everyone did the $20, obviously not everyone's gonna be able to pay for that, but if majority paid the $20, does that, help pay for the insurance?
It
goes into a fund that helps pay it. So if you probably couldn't offer that if you didn't have very many people opting into that. Correct?
Correct.
Okay. And I'm sorry, I'm just talking this out, because the way I read it was more of this was an option for the parents. I didn't realize that we needed to choose which option tonight.
I understand it's probably a lack of good description in the info form for my part.
So on options 1 through 3, these are all let's call them self-insured within the school district, none of these are using an outside insurance company to insure these damages. Is that right, or am I?
Correct.
Okay.
And my understanding, you have verbiage in here for every student, 3rd through 12th, but Mr. Christie, after discussing a few things today, we will have Chromebooks for
We'll start.
through kindergarten,
Working that tomorrow.
K through 12?
We'll be working on that tomorrow.
Okay.
That really wasn't an option to consider for tonight on the virtual. We'll begin to work on that tomorrow.
Well, I guess I'm asking, should we change this
Yeah.
document to represent those grades?
Yeah, I believe I started this document back in May. So
Yeah. Yeah, I
been added
understand.
edited.
So will they pay this fee when they pick up the Chromebooks? If you do the $20 fee?
Yes, that would be part of their school, oh, that would be part of their school fee if they did option.
But you're going, I mean, since we're doing virtual now, they're gonna actually come and have to pick these up.
Somebody will have to, physically have to pick it up.
Yeah, so that's what I'm saying. So that's when they'll pay that $20 fee.
Yes, and in the asset management, asset tracking software that we use, that all of our librarians use, there is you can create a checkbox and then notes. You can actually say how much, check whether each person has paid their $20, notes underneath of it, screen was replaced by $60. It just stays with them from year to year.
But that was gonna be my next, like, what if little Sally comes to pick up hers and she don't have her $20? What do we do there?
It's,
She won't get, so then,
Go back there, $20.
then they're
That may be one of
very.
those case by case or school by school basis.
What was y'all's thought on whether this fee, whether it's $10 or $20, whether people on free and reduced lunch are exempted from that? We think they are? Yeah.
Other districts that have given me this information have said that they've exempted free and reduced lunch.
And the schools have that list of those students, and there's other fees that are associated with schools, and they know which students are, and they just leave it on the list of the other fees that they pay. So they are exempted from other fees.
And I'll say that I would say most, if not all of these numbers are obviously malleable. You don't have to go with $20 for option one. You don't have to go with $70 for option B for the second damage.
We don't really know what the optimal thing is.
Pardon?
We don't know what the financial impact of any of this is, because it'd just be a lot of gigantic projections and guesstimates.
Yeah, it's a lot of projections based on what other districts that have been doing one-to-one have seen the last several years, and just estimated costs. We may come up too low, we may come up too high, and just be able to use that to pay for repairs the next year and lessen the fees we collect.
Have you seen other people use option 4, which is you just basically charge people who break their daggum Chromebooks?
Yes. Yes, I've heard from districts that have used all 4 of these options. That's why I included
I feel uncomfortable making families pay for something, because we're in a COVID situation that's no fault of anyone's.
They broke it.
No, I'm talking about if they broke it, pay for it.
Yeah.
I'm talking about a fee charge.
Okay, I'm sorry. Yeah.
Yeah.
Okay.
Yeah.
I'm sorry, I'm like, I'm for 4 myself.
Yeah.
The people who break it.
No, if they break
other
it,
people
then they
don't.
should be held responsible to repair it. Yeah, I completely agree. But charging a fee for this first year, especially in the environment that we're in, with families struggling already, it's a burden I hate to put on families for this first year. And then, after this first year, we can assess, okay, how many was damaged, maybe get a little history going on identifying an estimated cost, and maybe at that point, next year, when we issue Chromebooks, we kind of set a fee maybe it's $5 fee, whatever the number is, because right now we don't have a history of what we're gonna incur.
I'm having a hard time hearing, so you're saying like an option, you're talking about an option 5 where they don't pay anything and we just eat the cost?
No,
We stopped at 4.
Okay.
Yeah, no, I'm talking about option 4, not charging a fee, but they will be responsible.
That's a close one.
I'm uncomfortable charging a fee for the first year in an environment that we're in that's no cost, that's no, we're putting an extra burden on families that a lot of families are struggling right now, out of work. And then, next year we'd come back and maybe charge fees after we get an idea on how much it cost us or how much damage was done and what was, because some families, even if they damage the Chromebook, they're not gonna be able to pay for it. We can kind of determine what our out-of-pocket costs were to repair it.
That's what we pay Brian for, make him go deal with it.
Yeah, well, that's true.
I think you give some value to the Chromebooks if there's a fee. And and it doesn't need to be an exorbitant amount, but I think there needs to be some fee to cover.
I agree, even if it's something small like $5 that puts stake in the game, I guess.
Right.
I could go along with a smaller one.
But I think the downside of that is they pay $5 or $10, depending on how it's worded. They think, well, I can, I've got insurance, I pay $10, I don't have to take care of it.
I'll just get me another one when
Yeah.
this one breaks, yeah. I think
I think it depends on how that's worded. If they think it's gonna cover all the repairs for $10, so they don't have to take care of it, I'm not sure that's the incentive we want to put out there, so it would turn on what the wording is of that fee, what that fee is for.
Right.
I'm happy to reword it, have Mr. Thomas look at it again and submit for the next board meeting. If that's what you all would like. If you all narrowed it down to one option, I could expand that option and make it clearer what's required.
I kind of liked option 4, that they, let's see, wait a minute, option 3, where they pay a fee, and then if it's lost or stolen or damaged, and we have to buy another one, that there's some kind of cost associated with that.
That's the Woodford County model.
That includes the chart per 2.
Pardon, sorry.
Yes.
Number 3 then refers to the chart per 2. That seems so complicated.
Well, it's a fee.
So 2, they have no fee.
Correct.
And the cost to repair is associated, you have those listed.
Yeah, associated with the number of times they damage it, I guess.
Option 3 is they pay a smaller fee, like $10, but they still pay $50, for first accidental damage.
Kind of like every time you
Option 3 could be
Yeah, it's like an iPhone.
Could be pay the $10 fee and then combine it with option 4 instead of option 2, where pay the fee and then pay for the actual damage.
Yeah.
Again, it would just be whatever you all want. I can reword and elaborate on. Good at elaborating.
I mean, if you get, like Mr. Richardson said, option 3, it kind of limits the parent's liability, which is good. Where like if the first repair, $175, if they would only have to pay $50, right? If they paid like a $10 fee.
Well, if you determine it's accidental.
Yeah.
Accidentally dropped it in the tub.
Well, it could be an accident. They could have been working and then it just accidentally fell up.
There'd have to be a full investigation.
A hot tub. Let's make it the hot tub, make it a friendlier example.
Well, I'd be okay with a smaller fee, like you mentioned.
Okay.
So the advantage of, let's say it's $10, and then you really refer to this chart, is it maybe seems more tangible, or $50 or $70 or something like that, that's something they could pay. If you go with number 4, they're like, Well, I don't know how much it's gonna be, and so you're screwed, you're grounded for a month, but they still don't repair the thing, and they don't come up with the $200 and some to replace it because they don't have it.
It's just like Mr. Christie said, we understand that there will be some devices where we just have to eat the cost.
And refresh our memory, what's the cost of Chromebook per student?
The ones we ordered in June are the ones we ordered in June are $205.
Okay.
Is that the same cost under the new supplier?
Is that the same cost as what we just ordered?
Are we getting the ones we ordered in
The new
June?
supplier, they're about, what, was it $20?
$270, so about 65 more.
So at some point, I mean, it makes sense, you have to reevaluate, do we actually repair it or just replacing it? Okay. Well, I like 3. I can go along with 3.
With a $10 fee?
Mm-hmm.
$10 fee for everybody?
For each Chromebook.
With large families, should we put a maximum on it? I mean,
That's what I was thinking. It's not what the tiger over here is thinking. Sherry's totally just changed on us since the last meeting. She growled at me and Brian jumped. I mean, that's what I said, or go down, like 10, and then if pay 10 the first time, then 5 for everybody else, or whatever.
That seems complicated. Just make it $10 per kid. If you had all those kids,
If
you
you
should have
had
figured it
6
out.
kids.
Well, you should have thought of that before you had 6 kids.
Oh, dear God, Scott, just,
they didn't know that.
Well, we're not even
They're
charging
sitting
them
all
school
home.
fees anymore.
oh, for the love of God.
Actually, I will say, if you do that option, it might be hard if you have kids at different schools.
Well, that's my concern. It'd be different.
Which kid's gonna get discounted?
With all this technology stuff, there's no thing you can just put in there and be like, doo-doo-doo, and it pop up and be like, okay.
Well, then you're gonna have to get down to counting what kids are in what family and
I ain't talking to you, cause you over there trying to say people
What?
don't need more than 2 kids.
I got 3. We could discuss whether I needed more than 2.
There are people in this district that have several kids. That's a lot of money. You're talking, if they've got 5 or 6 kids, that's $60.
But I just bet you're gonna get into a discussion about, does this mean per household or per family or per parent or?
It's per Chromebook.
I got I got that part, but at what point in time do you get the discount for having so many
Oh.
kids in a household, or so many per family, so many per parent?
Oh,
It'd get
gotcha.
tricky. I'm just saying.
I see.
$5 Chromebook.
Huh?
Do $5 Chromebook.
So we're pushing Scott's buttons now down there. I can do 5. 5 would be good.
You don't mean you're paying it for everybody, just,
Per Chromebook.
you're not paying the 5 for everybody, but that would be our policy on 5.
What?
Just kidding.
Oh, no, I'm not paying that. If I was paying that, I'd be like, put it on Scott's tab.
Put it on the tab. Let it roll.
But I don't know. What do you think over here, Tiger? Or 5, is 5 good?
I think 10's good.
This new Sherry's just, she's feisty.
And they're probably not gonna
Well,
pay
give the one
anything.
on the end to chime in. What do you think, Gordon?
I'm just like a little red wagon. You can push me or pull me.
Do you
Five
have an
is
idea?
good with me.
5 is good?
5 is good.
5 is good.
5
We'll make the motion.
5 combined with option 4 or option 2?
Oh, gosh. Come on, Justin, now, we were making progress.
It was with 3.
It was option 3.
Option 3, right?
Option 3,
Yeah, with the
with a
$5.
$5 fee and,
$5 fee combined with option 2.
correct.
Did you just say option 2 or option 3?
Option 3.
Okay.
Option 3.
I can't hear with this mask on.
It ain't covering your ears.
It's my store and I'm taking it with it.
Do you hear out your nose down there? Is somebody making a motion? Sherry, did you just make a motion?
Should we make a motion to
Yeah, go
amend
ahead.
the language, though, to include K through, is it K or pre?
Okay.
Are we gonna do 3 for Chrome?
Or do you even need to specify the age groups?
Our desire to move to laptops K through.
Okay.
With no discounts for families, right?
No, $5.
$5 per Chrome. That's reasonable.
Okay, so who made that motion? Bill's.
No, did she make the motion? You made the motion, right? I'll second it.
Do we need the wording? Do you need the wording?
So it's the approval of the student Chromebook one-to-one agreement form, option 3, with the $5 fee combined with option 2, and to change it to say pay for.
Correct. Yep, you got it.
Could I ask for clarification?
Arlene?
I'm assuming this is Mr. Thomas's version of the agreement.
Yes.
Okay, just wanted to clarify, since there's 2 in here.
One of these days, we're gonna look over and Bill's gonna have to mask it.
The one that was uploaded with Brian Thomas at the end, that was the revised.
Okay, I just wanted to clarify, that's the one we would be voting.
Okay, so is the motion by Ms. Richardson?
Yes.
Okay, and seconded by Talby. All right, all those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Need a motion to adjourn.
Make that motion.
Motion by Mr. Talby,
All right, I'll second it. I was having a really
second by
good
Mr.
time.
Heisel. All those in favor say aye. Opposed? Motion carries 5-0. Whew.